Business Manager for Solihull Safeguarding Adults Board. And together with Solihull Council, we've been running some safeguarding webinars throughout this week. The theme for Safeguarding Week is creating safer cultures, and today we're joined by John Ibbotson and Carl Gilson from the CQC, who will be talking to us about closed cultures. Before we start, just a reminder to everyone to please keep themselves muted so we can reduce background noise. We are recording the webinar and this will be shared along with the slides after the session. We will also be sharing a feedback form after the session, so please, if you can complete that, I'd really appreciate it. It's really helpful for us to get feedback and to help us to plan future sessions. If you have any questions, if you can put these in the chat and I'll collate those and share them with John and Carl after the session, that will give them the opportunity to provide full responses, which we'll share with everybody once we've received them. Finally, I just want to mention this presentation does include a short video partway through, which covers the topic of suicidal feelings and self-harm. If you think you might find that upsetting, please don't feel that you have to watch that. Step away from your screen for a couple of minutes. That's absolutely fine. We will let you know when that's about to start. And like I say, it is just a couple of minutes long. So I'd like to hand over now to Carl and John.
Okay. Firstly, I'd like to, obviously, we both like to thank Rachel and the team for inviting us back today to give you an update on closed cultures as part of Solihull Safeguarding Adults Board's National Safeguarding Adult Week events. And this follows our previous presentation on closed cultures around 12 months ago. So just to introduce myself, my name is Carl Gilson. I'm an inspection manager with the CQC, obviously. Currently manage a team in Birmingham and the Black Country Tree. I live here in Hereford and I previously managed our local inspection team in Herefordshire and Worcestershire. I've worked for the CQC for about 6 or so years. So before becoming an inspection manager, I was an inspector in our adult social care directorate. And prior to joining CQC, I was an operations manager in the private sector. So I've worked within adult social care for pretty much my entire working life. And I'll just let John introduce himself.
Hello, everyone. My name is John Ibbotson. I'm an inspection manager, and again, obviously with CQC. So I currently manage the Hereford and Worcester team, but live down in Somerset, actually. I've been with CQC, similarly to Carl, for about 6 years. And before becoming an inspection manager, I was an inspector. And then prior to that, I worked for a local authority in the East Midlands. And then even before that, in the dim and distant past, I worked in care provider settings. So again, I've worked in care since the age of 21, 22, basically. So yeah.
Okay, thanks, John. So the focus of this presentation today will be very much on how CQC's closed cultures work has progressed over the last 12 months. We were very conscious that we'd spoken to you about closed cultures quite recently, as in a year ago, and the presentation will really cover the efforts that we've made at CQC to improve our regulation and our ability to identify and respond to closed culture services. So the slide pack that we're about to show contains a number of links to further sources of information. We've shared these slides with the organisers of today's event in order that they're able to distribute these after our presentation. So can I have the next slide, please? Okay, thank you. So before we get into the full presentation, I just wanted to quickly recap on what we mean by the term closed culture and why we at CQC are doing this work. So when we say closed culture, we mean a culture with an increased risk of harm. This can be deliberate or unintentional and can include human rights breaches such as abuse. We know that closed cultures and the possibility of breaches of human rights may occur across a wide range of health and social care settings. We also know that some services, such as places where people with a learning disability or autistic people live, are more at risk than others of developing closed cultures. Based upon CQC's experience of regulating services and responding to closed cultures, we have identified a number of inherent risk factors which make the development of a closed culture more likely in a given service. These include, as shown on screen, people receiving care have a poor experience, people are removed from their communities, people stay in services for months or years at a time. It can also be where there's a service which has weak leadership or where staff often lack the right skills, training or experience to support people. Can I have the next slide, please? So for more information about the inherent risk factors that increase the likelihood a service might develop a closed culture, the warning signs that suggest a closed culture is developing or is already developed in a service, the ways in which CQC seeks to identify a closed culture through our registration, monitoring and inspection of services, and the action we take where we find these concerns, you can visit the links that we've got on screen here to our website. That was very much the sort of focus of our last presentation. I felt it was important to kind of guide you to our website and the guidance if you wanted a reminder around what a closed culture is and what kind of risk factors and warning signs we can all look out for as professionals when going into service. Another useful resource is issue 12 of CQC's monthly COVID-19 Insight report. Hopefully you're familiar with those reports. The issue that I'm talking about was published in July of this year, and it highlights what CQC have learned so far about how risk can accumulate and can build into a closed culture. This learning that's presented in the Insight report was drawn from a sample of 29 inspections of independent mental health and adult social care services where we found evidence of closed cultures. Can I have the next slide, please? So just to provide a very brief recap on the background of CQC's closed cultures work, I'm sure you'll all remember Winterbourne View, which marked its 10th anniversary this year. Then more recently, we saw similar horrific cases of abuse at Whorlton Hall Independent Hospital in County Durham in May 2019. Following that, CQC carried out 2 independent reviews looking into our regulation of these type of closed culture services. You'll see from the timeline on the screen that the first report from Glynnis Murphy was published in March 2020, with a second report in December 2020 since we last spoke to you. Glynnis makes a number of recommendations for CQC to strengthen its inspection and regulatory approach for mental health, learning disability and autism services. In October 2020, we published our Out of Sight, Who Cares report, which you may be familiar with, which was the outcome of our national thematic review looking into the use of restraint, seclusion and segregation for autistic people, people with a learning disability and people with a mental health condition. This included 17 recommendations for CQC itself and for the wider system. So this brings us to now. So as hopefully you're aware, CQC launched our new strategy in May of this year, which focuses on people's experiences of care and support, as well as inequalities in care, which we have seen time and time again in our closed cultures work. Obviously, we haven't got time in the presentation today to go into sort of details of the strategy. Hopefully you're aware of it. And our closed culture work has really fed into that strategy and it's informing how we continue to work moving forward. Can I have the next slide, please? So I'll now pass over to my colleague, John.
Who needs to take himself off mute, sorry. So just to bring things to life a bit, I'm getting quite an unpleasant echo of my own voice. I don't know if anyone else is getting that, so I apologise if you are. But anyway, so just to bring this to life a bit, these are some quotes from people who have had experience of being supported by a closed culture, or family members whose loved ones have been in a closed culture. And I just wanted to read this one out because I think it's particularly powerful. It's the second one down. So, if I complain, you know they'll take it out on him. It'll make things worse. In the end, I was nice to them, as I realised. And now I have this trauma about that I was nice and I basically colluded with them and sold my son out. I think it's a really powerful quote from a family member. I'll just pause for a moment so you can read the other 3 quotes on there, just to get a sense of what people's experiences are. Okay, hopefully people have had time to read through, and obviously this will be available afterwards. I think what those quotes do is kind of bring to life a bit what it might actually feel like and be like to be in a closed culture. Pretty stark, really. Can I have the next slide, please? So, oh, I've got someone else talking in the background, I think. I just wanted to, we just wanted to cover some of the impact of COVID on the potential for closed cultures. And I think adding to the importance of our ability to identify and respond to closed cultures effectively is that during the pandemic, I think it's fair to say there's been an even greater likelihood that inherent risk factors of closed cultures could be present in more services, and that closed cultures could well develop in previously open services, or services where there are existing closed cultures could flourish. And really that's down to a combination of factors. Firstly, reduced external oversight. So more services have been effectively operating as more closed environments due to a reduction in external oversight and scrutiny by family, friends, advocates, visiting professionals, commissioners and CQC inspection teams. We all know there was because of the pandemic, there was a bit of a drop off in crossing the threshold, and crossing the threshold is really, really crucial in helping to identify closed cultures. Secondly, I think services under increased pressure. So care services, as we all know, are having to cope with unprecedented pressures on during the pandemic, struggling to maintain safe staffing levels, while some staff members are unable to attend work for COVID related reasons. Leadership challenges also, perhaps due to the absence of a manager due to sickness or self-isolation, and that can sometimes affect the ability to monitor and address staff practice to make sure that closed cultures aren't developing. And under these conditions, it's perhaps more important than ever that we identify where closed environments might develop into closed cultures. And as our CQC inspection teams have to be mindful of the impact COVID is still having on closed cultures. And also to the possibility that any service, even those with a good regulatory history and without apparent risk factors, could start to display those warning signs of closed culture. Okay, can I have the next slide, please? Okay, so a number of things have been happening within CQC to try and make some progress, some real progress and improvement in the way that we regulate services with high risk of becoming a closed culture. So staff training, for example, in summer 2020, we trained over 2,000 staff on closed cultures. And since May 2021, we've been rolling out learning disability and autism training, which includes stop over medication of people with a learning disability, also known as STOMP, which I think some of you might have heard of, curious conversations around what is autism, and videos of people with lived experience sharing their stories. And there's also been some beginner level training in things like Makaton, picture exchange communication systems and British Sign Language. We've also signed up to deliver Oliver McGowan training, which is currently being piloted. And as you may or may not know, this training is named after a young man living with autism who died after being given antipsychotic medication in a hospital in Bristol in 2016. And so really drawing on the existing best practice and the existence of expertise, of autistic people, people with learning disabilities, family carers, that training's really designed to ensure staff working in health and social care get learning disability and autism training at the right level for their role. And hopefully this will give people a better understanding of people's needs and potentially better services and improved outcomes for people. Okay, so next slide, and I will hand back to Carl.
Okay, so in line with our new strategy, we have been working hard, as John has already touched upon, really to equip our inspectors with as many tools as possible to be able to communicate with people using services, no matter what their communication needs may be. My colleague John has already talked about beginners training being made available to our inspectors in Makaton, PECS and BSL. But in addition to this, we have produced a dedicated CQC intranet page with all the tools, guidance and training as a one-stop shop for our inspectors. This also includes the option to book an interpreter to join an inspection team where necessary. So, with all of our closed cultures work, we're doing it with the purpose of ensuring that we've got enhanced tools, enhanced approaches, enhanced policies and protocols that will better arm our, inspection teams to really get underneath the skin of services and identify and respond to closed cultures. We've also updated a guidance document for our staff on meeting people's communication needs. This guidance is designed to ensure people are able to give us their views, ideas and experiences easily and in a way that meets their needs, and covers what inspectors should consider both when planning and conducting inspections to promote effective communication. We've also produced, which you may be aware of, an easy read document to hand to people when arriving on inspection, or to be shared with them shortly in advance of an inspection by their respective service manager. We've called these documents a visit from CQC, and I think they're quite important, really. They explain to people who CQC are in an accessible form, why we are there, and what they can expect from us having us in their homes or services, to kind of allay people's anxieties and also, to prepare them for participating in that inspection, really. In addition, we've also been piloting the use of a communication tool called Talking Mats. In case you've not already heard of this tool, Talking Mats is a communication and interactive symbols tool to help people overcome communication needs. The tool uses unique, specially designed picture symbols to aid in communication, which can be used digitally or physically. Professor Glynis Murphy recommended that CQC inspectors have training in alternative and augmentative communication tools such as Talking Mats. 19 CQC staff were trained in the use of Talking Mats. The pilot which followed this training has been a great success, and work is now ongoing to decide on the next steps for the use of our, for our use of Talking Mats. I just want to sort of share with you the experience that one CQC inspector had of using Talking Mats on inspection. And they talked about how this enabled them to give a voice to a man in his 60s who was non-verbal and who had severe learning disabilities. Use of Talking Mats had resulted in improvements to this man's living environment. The inspector described the physical cards, using the physical cards with this man as follows. I managed to do a mat and sub-mat with him, and for what I think was the first time ever, he had a voice and could communicate. Staff at the service were left speechless after realising that the man in question was not playing a card game as they first thought, but that he was organising the mats in his own way. The inspector was able to let the man use his own creativity with the mats, and as a result, this revealed that the man was unhappy with some aspects of his living environment, including his bedroom, which he disliked as it was cold and noisy. The service was informed of the feedback, and they have since taken the man shopping for a thicker duvet, and they're fitting door closers near his room to prevent them from slamming. So that was an example of where, for one individual at least, the use of Talking Mats really enhanced their ability to communicate and bore, clear dividends, because it led to an improvement in their living environment. Can I have the next slide, please? So moving on to another aspect of work CQC has undertaken to improve its regulation of services with a high risk of becoming a closed culture. So since we last spoke with you, in May 2021, CQC updated our closed cultures guidance for inspectors. And as you'll know, because I think it's already been mentioned, or it's certainly linked here on this particular slide, this guidance is available to all outside of CQC. Listed on screen are some of the improvements that CQC has made to this guidance. Amongst this, you'll see that there is now a new section in the guidance on human rights that now also includes the specific regulation breaches from the Health and Social Care Act. We have also included clear methodical steps for inspector to follow in terms of how they plan and conduct an inspection of a closed culture service. And we've also reworded one of the sections to emphasise the importance of giving weight to feedback received from those who receive care, their families, friends and advocates. And that's, a sort of clear drive of our closed cultures work, as we'll come on to discuss further. this clear, firm focus on capturing the views and feedback of people that actually, use care. The updated guidance, which helps our inspectors understand how to identify and respond to closed cultures, as I've mentioned, can be found on the CQC website at the link shown here on screen. And if I could have the next slide, please, I'll now pass over to my colleague, John.
Okay, so just to talk about surveillance. We've seen an increase in the use of surveillance across all services, whether that's paramedics wearing body cams or someone with dementia wearing a GPS tracker in a care home, along with CCTV being used in hospitals. So amongst the recommendations that Professor Glynis Murphy made to CQC when she did her review was for us to consider how we could play a part in assessing how providers are using surveillance. So CQC carried out some internal external engagement on this, including extensive internal engagement, a survey of 67 providers, meetings with adult social care trade associations, a workshop with people with lived experience of this, and a workshop with a mix of providers, members of the public and national stakeholder organisations. And what came out as a result of that, and what people told us, was that CQC should question how providers are using surveillance and ensure that it's proportionate and it's not done in a way that breaches human rights. Clearly we have a role in making sure people's privacy and dignity is upheld. Also, that a provider's decision to use surveillance should be well documented with some kind of rationale as to how the chosen method is the least restrictive choice. There was a general feeling that a lack of national guidance was not helpful. And people with lived experience felt that body-worn cameras increased their levels of anxiety and could be triggering for some people. But to balance that, part of the feedback was also that not all surveillance is negative, and there were some positive examples shared of acoustic monitoring technology being used appropriately in adult social care settings, as an example. So on the 2nd of November 2021, we published some guidance for inspectors to help them assess how providers were using surveillance. And there's some guidance available on our website, and there's a link there in the slide that you can follow. Okay, so the next thing we're going to do is play the video. It's a 2-minute video that was mentioned earlier. And just to repeat before we play it, this is a real story. It references suicide. So please do feel free to do whatever it is you need to do, mute or walk away from a computer if that's going to be something that you think you might find distressing. It is quite hard-hitting, this video. So just to again repeat the warning there. So if you could play the video. So yeah, a very, very hard-hitting video there. And really, it just gives you the opportunity to reflect on how it can feel to be on the receiving end of surveillance if you're being supported by a service, specifically CCTV, I think. Okay, next slide, please. So, hearing quite a loud noise on my window. Okay, on the 8th of September 2021, we published a report called Home for Good, and there's a link to it on the slide there as well. And this report shared some positive stories of people with a learning disability and or autistic people living great lives in the community, really through a concerted effort across multiple agencies working in partnership with the people supported and their families. And this report includes 8 stories of people who've been previously placed in hospital settings, all of whom are now thriving in community services across England. And there's some real key themes of successful community care, and the things that come out as being hugely important for that to be successful are, you know, and these won't surprise any of us, but they're things that we really need to focus on. So services being bespoke and person-centred, agencies working together, appropriate bespoke housing and environments, really key, and family involvement for good community support to work successfully. So I'd encourage people to have a look at that report, because it's real kind of, it really shows how good it can be, I think. Okay, next slide, and I'll hand back to Carl.
Thanks, John. So a key focus of our closed culture work has been on transforming our regulation of services for people with a learning disability and autistic people. As mentioned at the beginning of our presentation, we have found that the places where people with a learning disability or autistic people live are more at risk of developing closed cultures than other care settings. So as part of this work, we've been carrying out pilot inspections of these types of services from March 2021 until the present time. These pilot inspections have been conducted by a multidisciplinary teams, cross-directorate teams within CQC, with a firm focus on observations of care and understanding people's experiences living in different care settings. During these inspections, inspectors have completed a new quality of life tool, which we'll come on to discuss in a little bit more detail shortly. Also, in May 2021, Debbie Ivanova was appointed in a new role within CQC as CQC's Deputy Chief Inspector for people with a learning disability and autistic people, and is very much leading our work to improve our regulation in this area. The work which Debbie is leading on is split into 3 particular, threads or areas, which we'll go into in a little bit more detail on the next few slides. But in brief, it is involved, firstly, ensuring our newly updated right support, right care, right culture guidance is being used by providers across the board. This is the policy which describes what we expect good care to look like for autistic people and people with a learning disability, covering registration right through to inspection. We're also reviewing our approach to inspections of services for people with a learning disability and autistic people, putting people's experiences at the heart of what we do and responding to risk swiftly with appropriate action. The pilot inspections that I've mentioned a few moments ago are an important aspect of this. And finally, we're also looking at access to services and what happens to people as they move between health and social care services, focusing on choice and consent, whether they've lived in regulated settings or in the community. Could I have the next slide, please? Okay, so looking at the first key area, the first sort of thread of our work around improving our regulation in this area. And this is about ensuring the right services are regulated or registered and regulated. We have updated our guidance on what we expect to see from providers, as I've mentioned, supporting autistic people and people with a learning disability. The updated guidance is titled Right Support, Right Care and Right Culture, and hopefully you're already familiar with this. It's designed really to improve our consistency in our approach to regulating these services and to make the expectation CQC has of providers supporting people with a learning disability and autistic people far clearer. This guidance is designed to ensure people have the right model of care and are going to a service that meets their individual needs. Autistic people and people with a learning disability are as entitled to live an ordinary life as any other citizen, as we know. We expect health and social care providers to guarantee them the choices, dignity, independence and good access to local communities that most people take for granted. And the diagram that's shown on this slide illustrates how we ensure people have choice and control over their care and support. Great, if I can have the next slide, please, and I'll hand over to my colleague, John.
Okay, so a second thread to the work that Debbie Ivanova has been leading on involves reviewing our approach to inspections of services for people with a learning disability and autistic people to ensure we're putting their experiences at the heart of what we do and that we're responding to risks with appropriate and proportionate action. So one example is this, get my words out. One example of this is Whorlton Park, that some of you may or may not have seen in the news. This is a service that had a long history of poor performance. It was understaffed, and its patients, it was a hospital, did not always receive kind and compassionate care. And as a result of the work put into this by a number of agencies, including CQC, this service has now been closed, and the people who were receiving support there are hopefully being much better supported elsewhere. We want our inspections to focus on people's experiences of care rather than what the provider or staff did within the service. And to this end, we've introduced a new quality of life tool for use on inspections of services for people with a learning disability. It's a tool for inspectors to use which focuses on an individual's hopes, aspirations and dreams. And that tool is also available on our webpage for anyone to look at. And as already highlighted in the presentation, we're also placing much greater focus on observation and communication during inspections, especially where people may be unable to advocate for themselves. And finally, we're working to ensure our inspection reports make it clear what people's lives are like in the service. So going forwards, our inspection reports will hopefully bring people's voice out much more effectively than they do currently. Next slide, please. So the third area that Debbie Ivanova has been leading on is looking at access to services and what happens to people as they move between health and care services. Now, for those of you who have been looking at this, and if you haven't had the chance to look at it, I'd encourage you to do so. So there's some changes coming up in the way CQC works, and some of those changes include a much more system-focused approach. And not only will we inspect and regulate locations and providers, we'll also be looking at how local health and social care systems integrate together. And this is really the start, I would say, of this work, and particularly focusing on people with a learning disability. And it's looking really at a number of factors. So how are people supported to access the right health services? How do people move between services? How do we encourage the right services to be developed in a particular area? I think we all know of stories and of difficulties in people having access to the services they need where they need them, and people ending up being a long way from their families and friends, for example, is something that really we've known about for quite a long time, and we really need to start making some inroads into that. And how do we make sure people are taking an active role in their care, and how are they supported to do that is a really key part of that third area of work. So next slide, please, and I'll hand back to Carl.
Thanks. So we've spoken to you about this kind of enhanced approach really towards inspections of services for people with a learning disability and autistic people, and the pilot that's been undertaken in that regard, and the use of the quality of life tool that we've sort of incorporated in these inspections. So in terms of what we've found so far from those enhanced inspections, the kind of learning we've taken from them. So we inspected an initial 8 adult social care services and 8 hospital settings. The experiences of people have been mixed across these different settings, but overall the kind of conclusions that we've arrived at is that many services are not meeting people's needs. Services of these types. Staffing and training are not person-centered, so not shaped around the needs of the people that are being supported within the service. People's living environments themselves may not be right for the specific needs of those that they are supporting. As part of the process of providing people's care, humanity is sometimes lost, and that overall services are not meeting the model and principles laid out in our registration guidance, right support, right care and right culture. So our new approach towards these inspections is, one sort of good news story really is that this new enhanced approach towards inspections has meant that we've been better armed and better able to take more enforcement action. And John's just, spoken about one example of that. But this has enabled us to, stop admissions to services, to impose conditions on providers' registration where we've needed to, or in the sort of more extreme cases to cancel providers' registration where care in a given service simply hasn't improved. Could I have the next slide, please? So as we sort of come towards the end of our presentation, and hopefully we've given you a sense of how closed cultures work within CQC has moved on over the last 12 months, and hopefully also at the beginning we gave you a sort of very brief recap of what led to this work, what a closed culture is, and have included sort of links really that you can use at your discretion if you wanted to remind yourself of how we can all identify and respond to closed cultures. But sort of lastly, moving on to sort of describe what what's next for CQC's closed cultures work over the coming 12 months or over the coming period. So we will continue with an extended pilot of the enhanced inspections of services for people with a learning disability and autistic people that I've already spoken about. And this is, central to our work in transforming our regulation in this area, really. And in December, next month, we will also be publishing a progress report 1 year on from the publication, the original publication of Out of Sight, Who Cares? And that this report will highlight where progress has been made, as well as where further change is needed to address the recommendations in the original report. Overall, we will be ensuring our closed cultures work within CQC continues to influence and shape CQC's future ways of working, our trajectory. As I've mentioned, it's embedded in our new strategy, and we want to ensure there is a key focus on the importance of observation and direct engagement with people who use services, staff, families, friends, and commissioners, and visiting professionals to make sure that that's very much the focus of all our inspection activity to get a clear sense from people themselves of what's living or receiving care in a given setting is like. And all of this taken together will enable us hopefully to meet Glynis Murphy's recommendations around understanding culture in a given service and ensuring that our reports and our ratings better reflect people's experiences of care. If I can have the next slide, and I'll pass on to my colleague John.
Hello. So just to finish up really, so this slide summarises all the different ways you can link in with the work that CQC is doing in relation to closed cultures, but actually in relation to the entirety of CQC's work. So at the top there is a link to sign up to receive our provider bulletin, which collates a lot of this stuff together in one place and has regular newsletters. That is a really useful thing to sign up to, I think. If you are someone who uses Twitter, you can follow CQC on @CQCProf. The link to it, well, not a link to it, but it tells you how to search for it there. We also have a digital platform, and that's called Citizen Lab. And this enables a two-way conversation between CQC and various audiences. So we really want to hear your views on health and social care topics through a variety of activities. So please do use the link and sign up to that. Podcasts. Most people I speak to didn't know that there are podcasts from CQC as well. And again, if you search for CQC Connect on wherever you would usually listen to podcasts, if that's something that you do. I've been taught to do it recently by my teenage daughter because I didn't know how to do it, which is a bit sad to admit, but it's true. And there are regular blogs that are published as well, and the link to those is there at the bottom. Okay, last slide, please. And that's it, really. Carl and I would just like to thank you for inviting us. It's always it's always nice to do things like this, to talk about the work that's happening, but also to kind of share stuff with external audiences. It's always a pleasure. So thank you very much for listening. Just a reminder that if you've got any questions, Rachel is kindly collating them, and we can provide proper responses to those once we've sent them afterwards. And that's it, really. So thank you for listening, and have a good weekend, everybody.
Thanks very much. Thank you.
Thanks, Carl. Thanks, John. Thanks, everyone.
Thank you.